Okay, I'm Nancy Smith from the University of Buffalo School of Social Work, and have Mike Langlois here, who's visiting from Boston. We're going to start by just talking right now. One of the most common questions I get asked are coming from people who don't know much about technology, social workers who say, you know, I don't have the time and energy to do this. Why bother? Why do I really need to consider using technology and knowing more about using technology?
Well, I guess I would sort of break it down into two reasons. The first one's clinical, and then the second one is in terms of building your business. So in terms of clinical, the reason you need to do it is because that's where your patients are living. That's where their emotional conflicts and their social interactions are often carrying out in terms of mediated environments with technology. For example, this last September, the Pew Internet Research Group did a study, and they basically mentioned that 91% of all adults now own cell phones. And something like 78% of teens now own cell phones. And of that, 60% of the adults use those phones, not just to make phone calls, but to actually access the internet and technology. And so if 91% of your patients are at a certain place, then you need to understand that place. So to be clinically relevant, you have to be able to meet them where they're at, and that's technology. Even if that wasn't enough, and as a clinical social worker I would hope that it would be, but even if that wasn't enough, in terms of building your business, if you're not able to start marketing your practice online, you're not going to have a very viable practice within the next 5 to 10 years, I would say. That if 91% of people are looking on the internet or looking on their smartphone to find help, whether it be medical help or other sorts of resources, you need to be there. That this idea of getting your name in the yellow pages isn't going to cut it anymore. And that's just for private practice. I know that we also talked a little earlier about nonprofits, and you might want to speak to that.
Yeah, I mean, I think the nonprofit sector has become much more competitive in terms of agencies sort of vying for staying healthy and thriving. And in my experience, the not-for-profits that are doing the best are the ones that carve out niches for themselves, where people think, you know, you need really quality work done with adolescents, this is where you go. And so being able to employ technology in clinical ways that are relevant and use it on behalf of the organization, I think starts to become then a distinguishing characteristic as a niche. And for instance, I can't imagine working with adolescents well without really incorporating technology. And with families that are dealing with, all the issues in their lives, working with technology in our lives is part of it. And yet I know many agencies where that stuff doesn't ever get talked about. So here you've got an agency that starts to use this as part of, this is the quality work that we provide, and you really then are known as being cutting edge, relevant in terms of people's lives. So I think from a marketing survival standpoint. And I had a colleague who came back from a conference in New York City recently, and it was actually a little disturbing to hear him talk about this. But he said at the conference, several foundations announced they were no longer looking to the not-for-profit sector to solve major social problems, things like poverty. And they cited as one of their major reasons is the not-for-profit sector's lack of understanding about how to use technology in their work and to solve the problems where it's relevant. And that scared me because we have a huge amount of expertise in the not-for-profit sector, and I would just hate to see that thrown out because we are operating agencies in a 20th century model. And so I think that for an agency to thrive and for foundations and funding sources to be interested, that using technology effectively in whatever the work of the agency is really becomes an important survival strategy.
So, I mean, I think the parallel I see in both cases is it's not that we're saying people lack clinical skills.
No.
We're saying that differentiating technology, familiarity with technology and technology use as distinct from your clinical skills may not be something that's a good idea to do anymore. That you may want to be thinking of using technology and understanding what it means to use it and how to use it as part of your clinical skills.
Integrating it,
Integrating
yes.
the two.
Yeah, and when you start to think at the program level, probably there are amazing cases people can make and actually can raise money for a program now with, really effective internet marketing what are called crowdfunding mechanisms. And, they're not that complicated, but you need to be able to do it well, and you could make a compelling case for a new program you want to do. Those are things that are tools that people are not using as part of the effective way of running their organization. That can be at the program level and then down to the clinical level. And I think it is all about how do you integrate these skills into what you're already doing to move it to the next level and to make yourself relevant for what the current environment is asking all of us to do.
And I think we're going to end on that.
Yeah, let's stop with that question and give ourselves a chance to sort of digest it and move on to other FAQs.